Good evening. Today is August 20th, 2018. I'm Nathan Johnson. Welcome to our 49th episode of Veterans Voices. Tonight, we'll be talking about opioids within the veteran community. We'll be speaking with a few veterans and 2 VA doctors about this issue. As always, we want you, our audience, to call in and join the conversation. I'm grateful to be joined by my co-host tonight, Air Force veteran Kira Cerna.
We're here tonight to talk about opioids in the veteran community. Let's start by hearing from a veteran who has experiences with opioid addiction.
My name is Jerry. I was a veteran from the U.S. Air Force. I served in 1960 through 1964. I was honorably discharged at that time. Towards the end of 2011, I was at my doctor's appointment, and he says, "I'd like for you to see a cardiologist soon." I went in 1st of December, and they did my heart surgery, and then everything started going crazy. January, I developed a full onset of shingles, which was probably the worst pain I've ever had. It was supposed to last for a couple of weeks. It lasted well over a month, and like I say, the pain was excruciating. It was just all I could do was sit in a chair, watch TV, and cry. They changed my meds at that time from Valium to oxycodone, and that was lights out for me. I'd wake up in the morning, take my oxycodone and wash it down with vodka, and from then on it's sort of fuzzy. Got addicted to the oxycodone and started standing up and falling over. At that point, my significant other and my 2 sons said, "You need help, Dad." So they got me a private facility. When I got out, I relapsed almost immediately. I didn't have the oxycodone, but I was going back to the vodka and so forth. A neighbor suggested I go to a facility in Mesa. After 90 days there, the first day I relapsed again. I had to stay away 5 days before I came back for another 90 days. Same story, different day. The day I got out there, I relapsed again, ended up in the hospital. Called my significant other, my life partner, actually, we've been together for 30 years. Called her, and she says, don't come back till you're well. So I didn't sleep. I just had thoughts of suicide.
Welcome back, and thank you for tuning in tonight. If you're at home watching and want to join our discussion, please feel free to call us right now at 925-313-1170. Our phone lines are open, and we're excited to take your calls. You can also send us an email at veteransvoices@contracostatv.org or connect with us on Facebook at Veterans Voices 1.
We would like to welcome Dr. Joan Coten and Dr. Colin Fernandez to the show. Welcome. Thanks for being on the show tonight.
Thank you.
So tell us real briefly about yourselves.
So I am a pain specialist. I've been with the VA since 2003. Basically treating chronic pain on an outpatient basis.
So a pain specialist, that's a medical doctor?
Correct.
Okay. And you're the only person in your position in Martinez, is that true?
I'm it for most of the East Bay, actually.
Covering several different facilities.
Correct.
And can you tell us a little bit what you do on a day-to-day basis? What does being a pain specialist entail?
Sure. So I guess this may sound kind of silly, but the very first thing that I try and do is try and figure out where the pain is coming from. We're trying to figure out if there is an organic physical cause for the pain, if there are other things that might be interfering or changing the way that the pain is manifested. In some cases, it's really easy. We're able to pinpoint specific targets, and if we're able to do so, for example, in the spine, then we're able to target therapy specifically to a nerve or a nervous structure. It gets more complicated when you have multiple areas of pain, or someone is complaining of severe pain, but we can't really see something on imaging or lab tests that give us a clue as to what might be causing this. And so then sometimes we have to think outside the box.
Okay,
Thank you.
thank you.
And Dr. Coten, welcome back. You were on the show last month. I got to watch it from home, but I didn't get to be here.
One
so
substance to another, yes. I'm a psychiatrist at Martinez. I've been in the VA and mostly at Martinez for about 30 years. And you mentioned kind of where the pain is coming from. And I have seen Dr. Fernandez do a very amazing job with veterans where there is a nerve where the pain is coming from. It's also repeatedly reminding them of things that are very stressful and upsetting frequently when they were wounded. And, you know, you can kind of give relief to one, but we get complicated because there are behaviors and things that are going on that are multiplying it.
Right.
And those cases where there's a number of different things, either early life, you know, certainly the people that have injuries, people that have severe depression do perceive pain more. And so they're not sleeping, all of those things. So I often will collaborate with you for patients who have these complicated pictures where there's some PTSD, there's a good bit of depression, there's often a couple of different sources of pain. I think we've had some people who we treated for one, and then they went and got in a motorcycle accident and had a new one that we then had to manage that pain. And in the process, they got addicted to the opioids and started using them in very problematic ways.
So let me ask, when does it get to the point where medication is introduced as a therapy for pain? Is it typically something that a doctor recommends, or is a veteran asking for some type of medicine?
I would say both. So my view is probably highly biased because I'm a specialist. By the time people get to me, they've typically, you know, seen their primary care physician several times, had maybe physical therapy or acupuncture or chiropractic, sometimes several surgeries to help with the pain.
Oh, yes.
So I'm kind of the last stop. By the point that most people get to me, most of them are already on a cocktail of medications.
Okay. Prescribed by their primary care doctor?
Could be, or maybe initiated by someone else and then taken over.
Now, how does pain affect like psychotherapy and the role of a psychiatrist in terms of overcoming any type of post-traumatic stress or depression? Can it interfere with the ability to actually work towards
Oh, it can
improving life?
interfere a lot with that ability. But I think the other thing is we see a lot of veterans where pain is much more acceptable and frustration with the injury. And going on that focus, they get so obsessed with, well, this doctor's wrong or that one's wrong, or if they would just give me this or give me that.
Okay.
And they can get very, very insulted when people even ask them to see a psychiatrist. And even people that they know that there's some psychology to this will often fight it pretty hard. There are other people that are much more, I mean, we have a lot of veterans who don't get into trouble with that. They're able to say, every time this hurts, that's right where I was wounded in Vietnam. And, you know, this guy's had some surgeries. He got put on meds for pain acutely. He got off of them. You know, it's not, but it was still hard to treat his PTSD. just because he was so, now I'm fine, now I'm fine. Oh, wait, I'm not fine. But he actually managed his pain. I don't think he ever got sent to you because he managed his pain pretty
Okay.
well. So you see so many different things. There isn't a one, you know, it isn't easy to say you're going to get in trouble with those meds.
Well, I want to just real quickly invite our audience again to be a part of this conversation tonight. We're talking about a very difficult topic, the use of opioids, pain medicine to treat pain. And whether you've had an experience firsthand that has been successful and helpful, or whether you've had an experience that has been harmful to you, we'd love to hear from you. If you have questions or comments, you can call into the show now. Yes, yeah.
It's probably a good time to make a comment, and that is, people really need to distinguish between acute pain and chronic pain.
Okay.
Okay.
Yeah.
So acute pain is, I broke a bone, I had surgery. Pain is serving as a warning signal. Okay. And you want to pay attention to it. Chronic pain, which is pain that has lasted for more than 3 to 6 months after the initial injury, is a completely different animal. Okay. It is not a warning signal anymore. So it's a maladaptive response of the nervous system, wherein you can, I guess, conceptualize it easily as like a phantom limb. So the initial injury may have healed, but the nervous system is abnormally firing. There are pathways that are strengthened, that have electricity running through them. It's telling the person, so it's kind of masquerading as a warning signal, even though it really isn't. Additionally, you know, by definition, all human pain is experienced in the brain. Okay, so even though you may have a physical injury and nociception, which is those electrical impulses in nerves, so that's not pain. Okay, pain is those electrical signals coming to the level of the brain and being processed in a very complex manner. There are numerous overlaps, for example, between the same areas that process pain and PTSD, which makes complete sense, since both are kind of warning signals after a trauma, right? Pain and mood disorders. I think people have a hard time accepting, they want to focus on physical causes and don't really...
And the physical causes vary. I mean, you're saying the injury is healed, but I do think that sometimes there are things that hurt. You know, I mean, I have a minor injury, and it's like, wait, you mean it's always going to bother me? And it is. And it's a matter of how much attention, how much it causes problems, a lot of other things. And, you know, when people can manage it and when they need to be on different medicines. And there are a lot of medications now that get used for pain that aren't opiates.
Well,
And there are a lot of interventions that aren't opiates.
I appreciate the conversation. We've done, I think, a great job of just introducing this topic to our audience, and really just a discussion about pain is so important to then have a discussion about the use of opioids. We'll be back to this, but I want to first address a comment here from Facebook. April says, I have never been prescribed pain meds, and I'm going on years of pain, half due to the surgery performed by the VA healthcare themselves, and still they don't try anything other than antidepressants. They say the medication helps with anxiety and pain, but I haven't seen that yet. So we'll talk more about that. And thank you so much. We'll have you, two of you on our last segment of the show. Next up, we will be hearing from local Marine vet Mike Hudson about his experiences. Please stay tuned with us.
We would like to thank Mike for being with us tonight. Thank you, Mike. Mike is a Marine Corps Lieutenant Colonel, almost retired. Is that right?
That's correct. 2 weeks. They call that terminal leave, which is not an illness. It's simply the end of your active service approaching. So soon I will be a civilian.
Well, tell us a little bit about yourself.
Well, recently I was a battalion commander, so I commanded at the lieutenant colonel level, responsible for active and reserve component Marines, and I shared that responsibility with a reserve lieutenant colonel. For this current topic, both of us managed the substance abuse control, which is part of our good order and discipline. So that's something we had, and just to manage good order and discipline, you had obviously a substance abuse control effort. Marines and sailors are tested routinely, mostly unannounced. We did not have an issue with opioid abuse. However, we were aware and sensitive to the fact that we had a lot of injured personnel. I had an amputee that worked on my active staff. I had numerous veterans who had, I mean, you name the surgery, we had it in our battalion. And a lot of us, put off these surgeries for years simply to get the job done, or you not want to be left off of the list for a deployment or an operation. So then suddenly you find yourself in need of a serious surgery, and then you have the medical situation there, the pain.
But this happened to you. So you
Yes,
had
me as well. So it's,
Yeah.
I was kind of, I've had some surgeries before, minor stuff. I had a pretty major stomach surgery in February, and of course I was prescribed opioids. And I was in command at the same time. So it was the balance of, they tell you with a stomach surgery that's apparently pretty serious. So they told me, yes, this is serious. Of course I said, okay, yes, I'll be in and out of the hospital quickly.
this was not like a
good
weight
Marines
loss
do.
elective surgery. This was a
Quite
very serious
effective for
condition.
weight loss, though. If you're ever,
Yeah.
I wouldn't, not recommended for that, because then I missed out on what can I do physically afterwards, and that's the focus most of us have. How is this going to affect what I can and cannot do? I'm supposed to go to the field and conduct field work, operations at various places, and I need to be ready for that. Sure, okay, so you do the surgery. And then I realized this was pretty serious. Was told the surgery would take about an hour and a half. It took 6 hours. So apparently there's a little bit more wrong with me than we thought. But that's what happens when they open you up.
So how soon after the surgery did the doctors recommend that you take these medicines to help deal with the pain?
Well, it was immediate. So I was on, of course, morphine, hydrocodone, some other, a cocktail, a combination of drugs there. Then when I was released from the hospital, of course I went home. And then there was an expectation that there would be some time off, kind of just to heal. I didn't really have that kind of time. I was back to work, I think, 4 or 5 days later.
Wow.
So then I was frustrated because I couldn't, just climbing the stairs felt like a major event. Very frustrating. And then, of course, you cannot could drive a vehicle under the influence of, serious opioids. And of course, you take them in the evening, you find yourself having trouble sleeping. You feel great. There's definitely a high, a sensation, a good feeling sensation, but it's difficult to sleep. So then you're tired, that's. But really, my pain paled in comparison to family members, and of course those of my fellow Marines there. And really, now one thing to be aware of: some of us were on antidepressants as well. I was, though the leader, of course, of the battalion, openly would tell you that yes, that I was prescribed psychiatric medication as well. You don't mix those. Okay, no kidding. But these are things we have to watch. And as a leader, okay, I understood that, no, I'm not going to mix these types of medications. But you have to communicate that to your young folks, your personnel, because that combination could be deadly. And that's something I think we tend to overlook, because we focus on the mission, we focus on getting our personnel healed and back to use quickly, and understanding that they're going to be on some sort of medication for a period of time. But we have to take a look at all these other things too. We have a lot of, in my battalion, the majority of us were combat veterans. So you had individuals who were still dealing with the trauma of no kidding, real combat from Afghanistan and Iraq. Now you throw surgeries on top of that.
Now, when you took these medicines, did you feel like you got immediate and complete relief from the pain, or did it help just minimize the symptoms so that you could be functional?
Well, it did a little. Well, at first, it took a little while. So I found I could use less, and I was okay. So to go to the field, how am I going to sleep on the ground and do those things that Marines do? Wasn't very comfortable. So I took a little bit more for that. I actually found the travel, back and forth to some of these locations was more uncomfortable than expected. So I would, but it was strange to bring a serious narcotic to the field. But I had to go to the field, so that was just not an option, kind of to stay back and that sort of thing. But yes, it was. I think it worked. They worked very well. It just depends on when you take them. That's the difficulty. I can't take it in the middle of the afternoon, but in the evening, of course, when you're trying to sleep, it's difficult to sleep. At least I found it difficult to sleep after taking some of the medication, whether it be hydrocodone or oxycodone.
We've got a Facebook comment that I want to take here from Matthew Evans. Kira, I'll let you.
Okay, Matthew Evans says, I left the service as a staff sergeant on the E7 promotion list. Had planned on making it a career, but after 10 years, my back and left shoulder injuries wouldn't allow me to perform my mission safely. Refused any narcotics from 1985 until 2000. Finally, can no longer function. 3 surgical specialists said the surgery would do little to ease the pain and 50% chance of paralysis. Finally, my doctor and wife persuaded me to try opioids. I've gotten much relief, don't abuse it, and take what is prescribed or less every day. No longer able to work, but can live on my own and have enough function to do most ADLs. I guess it's how you use or abuse the meds that make the difference. And what would you say to someone like that?
Well, it's a personal experience. This is an individual experience. We just have to understand, the education piece, it is addictive. How many people are, the numbers, the math, all that sort of thing, you can become addicted to basically anything. But you know what, if it helps, you have to live, you have to function, you have to work, you have to be there for your family. I had a staff sergeant with severe back pain who missed out. He felt he's missing out on his child's life because he couldn't do anything. So yes, in that case, take the medication you need to function.
What about you? Do you feel that taking these medicines actually allowed you to continue in your role as a commanding officer, as a lieutenant colonel, actually continue out and complete your career in the Marine Corps?
Absolutely.
What would you have done without it, would you say?
I would have been in severe pain. I would have been even more cantankerous and angry than I normally am. So I would have been just that boss that probably scared people a little bit.
And did you ever experience any problems with the medication while you were taking it?
Just the sleeping.
The sleeping.
Very difficult to sleep. So then then I couldn't tell if I was still recovering from the effects of the surgery or whether or not this narcotic. So it was kind of new to me. So that yes, it was difficult to tell. So it definitely has there's a yin and a yang to it, right? There's positives and negatives as well. So you just have to be cautious with this sort of thing. But yes, if it makes you feel better, if you can function, absolutely. But that's where pain management comes in. You have to have that engagement, that relationship with the medical professional.
That's what I was going to ask. Is to what extent do you think your doctors really helped you by, one, making the right type of prescription, recommending the right medicine at the right dosage, helping you understand the effects of it, like the not sleeping part? Do you think your doctors really kind of walked you through that process?
Personally, no, I did not. So a lot of surgeons they're done. They've completed the surgery, and this is sort of somebody else's lane. Perhaps, and then this was not done. I did not have my surgery. My surgery was not conducted in a military hospital. I was on an independent duty status, so just a different sort of situation for me. So perhaps the military health or military treatment centers are better. I'm not 100% sure. I know some wounded veterans say, yeah, oh, absolutely. The counselors are there. The resources are there to help the individual. For me, it was simply Surgery is successful, here's your prescription, and off you go. And I had to just simply, make some common sense decisions. Am I going to use psychiatric medication and this stuff at the same time? Well, obviously not. I did the research obviously independently. What does oxycodone actually do? What does this drug actually do? I want to know what's going into my body. But does everybody do that? I would assume the answer to that question would be no. So I wanted to make sure, and I realized that a combination of medication can be quite deadly. And we need to do a better job of educating our personnel on that.
And were you having these conversations with your Marines as they were, if they needed to use any medications as well?
Yes, we were open about this. You had some of this, we just had so many injured personnel. Perhaps our battalion was unique. I felt my unit, during the time I was there, we had a lot of surgeries. But I'd have a guy, with pins in his shoulder, and he wants to participate in a rugby match. Right. So that's the type of people you're dealing with. So you have to pull them back. Say no, that's not a good idea.
Right.
And they did not want to take the drugs because they wanted to function properly. But others would tell me I cannot go about my daily routine without some sort of assistance.
I want to ask you one quick question because we only have about a minute left.
Sure.
What would you say to a veteran who's considering whether opioids or pain meds are something that they need to deal with to address their pain?
Number one, do your research. Two, see if there's any other way to mitigate the pain.
Yeah.
If the answer is no, take a look at your life. Can you function? Can you, are you missing out on your family?
Yeah.
Or what's the bigger need? If you're suffering from PTSD and you're on psychiatric medication and you have chronic pain at the same time, you have to triage that yourself.
Yeah.
You cannot take both at the same time. What is more important?
Well, Mike, thanks for being a guest on the show. Appreciate your perspective as well as your service. I want to address real quickly a comment from Facebook. Eddie says that he's been going to the VA since the 80s, 100% PTSD, chronic back pain, nerve and muscle damage, was just on too many pills. Don't take anything for pain now. He's saying he doesn't take anything for pain now. I've been exercising with yoga, but it still hasn't gone away. But it's better than being on pain pills. Thanks, Eddie, for your contribution to the show tonight. Next up, Ryan Berg had a chance to catch up with a few veterans at the VA Martinez for our Vet on the Street segment. Let's take a look.
This month we're going to be talking about opioids. Do you have any experience or thoughts about opioids?
I used to be on them for years. I was on morphine, Vicodins, Oxycontin, and oxycodone, and Valiums.
All at the same time?
Yeah.
And how was that for you?
Well, it worked for a minute, then it stopped.
Well, yes, I had experience with that when I had my knee operation. I had a knee replacement, and they gave me some of those opioids, and it helped me quite a bit.
And you didn't have a problem getting off of them?
Oh, absolutely not at all.
I lost a brother last year. He was also in the military. He had PTSD. He wasn't given the right prescriptions, and he didn't have a therapist, a regular person working with him to get through his things, and committed suicide, and he took medications. I forgot what the medication was, but he was getting it from other veterans, and it's a huge problem, and we're losing more people to opioid abuse, and I just think a lot more money needs to go into developing programs that help them get out of those addictions and into other wellness practices and not in just a pill. And it just sucks that all of our funds and stuff go to pharmaceutical programs and the physicians' pockets.
Well, I know people who I have people that I'm aware of that I have stuff that I don't use all the way through, and they tell me it's worth a lot of money in the street.
There's two types of pain. One is acute pain, and opioids are appropriate for that. In fact, I would say people are frequently undertreated for immediate pain because people are overreacting because of chronic opioid treatment.
I'm on morphine.
And how is that working for you?
Working great for me. It is. It's helping my pain. I have sciatica. And I'm coming in today because I got these problems with my hands. I got these sores on them. And so I'm coming in. I came in yesterday to make an appointment for today. So it's like an emergency. So my doctor said, come right in.
Do you have any? Are there any side effects that you're concerned about with morphine, or?
No, I take them they prescribe them to me, and they work fine for me.
In some states and countries, they use other things to help with pain, such as music, the more holistic kind of therapy. So I think that we should do more research and finding out what else we can use other than pills.
Thanks for staying with us. We're going to welcome David Dean and Mark Irvine to the show. Thanks for being here.
You're welcome.
Mark, tell us a little bit about yourself. David.
My name's Dave Dean. I served in the U.S. Navy River Patrol Groups 68, 69, and 70, and came back home. Back next month, it'll be 50 years ago that I deployed to Vietnam. So
thank you for your service.
So
yeah, you are.
Lived in the Bay Area all my life. Was born over at Oak Knoll Naval Hospital. And 62, we moved over here to Concord. So, and my favorite pastime is flying as crew chief on the restored Huey. And my claim to fame is I'm one of the only guys that'll get out of the helicopter and fly the American flag. I stand on the skids up until the FAA told us don't do that anymore.
Well, thanks, Dean, for being on the show. Mark, tell us a little bit about yourself.
I went into the military in 1971, and I was drafted, and I added another year on so that I could get guaranteed certain type of duty. I was sent to 18th Airborne Corps in North Carolina, and from there a couple of other units, and eventually to 5th Special Forces, where we were sent over to the Middle East, and I picked up a virus there that caused my body to attack itself. When I came back home, it had lain dormant in my body for a while, and then something triggered it in the environment, is what the doctor said. And so I started having these episodes if I stressed a part of my body just by picking up a box or something. And each episode would last about 4 to 6 weeks. And
what were these episodes like? Is this an episode of pain or sickness, illness?
Extremely painful.
Okay.
One example is I picked up a box of books, put it on my shoulder, and it put stress where the where the tendons and ligaments insert into the bone. And so it caused me it affected my occipital nerve and caused me to experience migraines every day for 6 weeks. And I'd wake up and here comes a migraine. I had to spend a whole day trying to repress it, do everything, turning down the lights, taking a hot shower, taking some medication, trying to relax, to prevent it from becoming full-blown. And so these episodes would come and go. Or in the early stages of the disease, it happened quite frequently. I haven't had one now for a couple of years, and
good.
I'm thankful for that.
Yeah, absolutely. Sounds miserable.
But it has the disease ravaged my body, and I've got this. The remains of that are that I've got no cartilage in my knees. It went from normal to 0 in about 1 year, according to the doctors. And I've got cervical spine problems, lumbar spine problems, need reconstructive surgery, both shoulders. And the Veterans Administration has not been very cooperative in terms of getting me my surgeries because they're expensive, and the initial response was just to put me on high levels of opioids and let me fade off into the sunset because of my age. And I didn't want that.
So do you take opioids now, or
Yes,
is this
I
something?
do.
Yeah, okay. And Dean, you also have had experience like Mark of pain. You want to tell us a little bit about that?
Well, the first times I took the oxycodone was when I broke my hip, and they gave it to me. And I took it for, I'm thinking about 3 weeks, maybe 4 weeks. I was taking 10 milligrams in the morning and 10 at night, and then I went to just 10 at night. And I soon found out, like Mark was saying, it keeps you awake. It doesn't, the pain goes away, but it keeps you awake. So I finally said, oh, I don't need this anymore. So I had the dancing feet for a couple nights, and then it was okay.
What's the dancing feet?
Nervous, your feet just start, jumping around, So then, I don't know, several years later, I developed osteoarthritis in the hip that I broke, and it hurt pretty good, so they prescribed oxycodone.
Now, you actually didn't get your care at the VA. You got your
No, I
care out in
got
the
mine
community,
through
right?
private.
Okay.
So I started on that, and then a year ago, last January, I had a horrible flare-up with rheumatoid arthritis, to the point I couldn't get out of a chair like this. And so I really was taking them. And eventually, with working with the rheumatologist, and I got some medication, they finally got it. My immune system slowed down, but you know, I was in pretty bad shape there for a while. But gradually, you know, when I first took it, you got a pretty good high. And I don't remember how long it was before that went away, but during the last 3 months, 4 months, it was a toss-up of whether I was taking the pill for the addiction or whether I was taking it for the pain. Sometimes they'd come to the same time, but sometimes they didn't.
So are you still taking?
No, I've been off for a month. Fortunately, I was at a low level. I was only taking 15 milligrams a day, 5 every 8 hours.
Okay.
And so I went through the clinic, through the Kaiser, and so I just went cold turkey. And it took about a week and a half of sleepless nights and restlessness and all kinds of stuff, but eventually it died off. And they were prescribing me different medications for the anxiety and stuff like that. And I kind of felt like that those pills, one of them was making me agitated, so I stopped them all.
And what initially led to your decision to stop taking the opioids?
There were several things. One, I hated the idea every time I went somewhere, if I knew I was going to be gone for a while, I'd have to throw one in a baggie just in case I was there too long. Or if I went on vacation, I had to make sure I carried the whole bottle, you know. And then we recently did a veteran's flight with a helicopter, and there was guys, we were sitting around eating, and I heard guys talking about the amounts of the opioids, the oxycodone, that they were taking, and it was a lot more than I was getting. And I didn't ask them why they were taking it, or you know, whether it was all prescribed.
Yeah.
I figured it's none of my business, but I started thinking the only way that I'm going to get these things to stop the pain completely is to take more, and I don't like it. And then I read, and I don't know how true it is, the doctors can answer that one of the side effects of oxycodone is joint pain. Well, that's what I got, is joint pain, you know?
Yeah.
So, and now, you know, the pain, I still have the arthritis pains, but with a little Advil, and I take gabapentin, you know, for nerve pain, and it's tolerable. So I figured it.
There's a comment here on Facebook that's very close to what you're describing, so I want to just address it real quickly from Stephen Vircher, because you mentioned the risk of addiction, right? And so Stephen Vircher says that he's on 3 different pain meds from the VA, and am still in constant pain, but I will not ask for any more and will endure the pain. I will not be labeled as someone seeking more drugs, nor will I run the risk of addiction to the meds I'm currently taking. I will continue taking the pain meds at their currently prescribed dosages, imagining that without them, I would be in more pain than I already am. Mark, what do you think about that in a sense of knowing that the addiction is a possible reality, but you could do without the meds and just deal with the pain? Is that something that's an option for you?
I didn't think so because the way that I was given the medication, there were periods of it normally coming, and then there were periods where it was interrupted and then started again. And during those periods of interruption, I felt the full effect of the pain on my body. And it was difficult for me to get out of bed. It was difficult for me to move around without having something. But that said, I don't like the addiction itself. I got tired of it.
Can you both tell me what does the addiction, what does it feel like when you feel like you're addicted to a pain med? What sensations do you have that tell you that maybe you are at risk of addiction?
The worst thing is that after I've been taking it since approximately 1995, 23 years, and it goes through different phases. At one point, your body, it becomes a normal part of your life, and when you take it away, it has a greater significance because it's no longer there when your body is saying, well, where is it? This is what our life is. And so you have to recondition your look on life to be able to deal with that.
But what do you feel in your body, though, when you feel this addiction? Okay.
When I'm without it, the pain is constant, and then the body is suppressed because the pain medication slows the body down, slows metabolism down. And so everything I did was very slow, and it was hard to go from one place to another. It just made it more difficult because you think slower, you don't think as well. And I took myself off a lot of it. I was taking 165 milligrams of opioids a day. And I didn't realize the effect that it was having on me until I started taking myself off. And I started reducing it on my own, and then my doctors, at some point, because I was making complaints, just cut off 1/3 all at once, without any warning or notice. And for 6 weeks, I couldn't function. I couldn't organize my thoughts. I was confused. I was disoriented. And
so it not only impacts your body, it impacts your thinking as well.
It's all related. It's all related. And it was the worst 6 weeks that I've had during the entire time that I spent on it. And the doctors every once in a while refuse to write the prescription on time. And so I go through these mini episodes of a couple days where my whole life is disrupted until.
Now we have just a couple more minutes, so I want to get from you. How are you doing now? Now that you have less medicine, or you're taking less medicine, I should say. How do you feel now as compared to how you felt when you were taking 160 milligrams or 15 milligrams a day?
How do I feel?
Yeah, how do you feel?
I feel better.
Yeah.
You know, because it was something that was strapped onto you, and I never have liked it. You know, or in the service, you didn't like to be trapped. You know, and stuff like that. And I feel sorry for the guys that are like, you know, on the high levels, because that's got to be horribly hard to come down off of. So I'm thankful that I was only on pretty much a standard low-level dose. But I told my wife, and I told my primary care, I emailed him, that the only way I'd ever take those games is if I was in extremely severe pain, or I was terminal, not retiring. Well, retiring for life. But if I knew I was on my way out and I hurt, I would just, you know, kind of like they do when they give the morphine and stuff like that. It's just not going to make any difference, you know. But beyond that, I wouldn't take it for.
And so, Mark, for you, it sounds like you had to communicate with your doctors a lot through this process. How important would you say it is for people to communicate with their doctors about their medication?
I wish there was. I had an appointment with pain management. I believe it was Dr. Fitzgerald, who was just here, and that appointment was canceled without my knowledge or consent. Whoever canceled it didn't want me to go through with the appointment. And there were some things that were giving me warning signs with regard to the medication, and I knew that I had to take myself off. So I reduced it down to about 20 to 30 milligrams a day of oxycodone and 5 milligram supplement tablets. And that was moving along, and I felt I could function pretty well. And when I got down to that level, I could realize the effect that it was having on my body, my mind, and I felt alive again for the first time in years. The 5 milligram oxycodone is short acting. It's not like the methadone and morphine that they had me on. And so there was a period in every day that I was without any, and there was normalcy. And
well, Mark, I just want to Thank you for being on the show. Unfortunately, we've run out of time for this segment, but I appreciate both of you being here.
No problem.
Not only for your
Anything
military
we can do.
service, but sharing your important perspectives on this topic. So thank you.
Thank you both.
Now we'll take a quick break and listen to the second half of the story we heard earlier.
I was on the bus riding from North Phoenix down 7th Street. The bus stopped at a bus stop right outside the VA, and I looked over and I said, I got to be in there. So I got off the bus, went into emergency, talked to a counselor, and about an hour later I was up on D5, and which was the psych ward, and I spent 21 days up there. After that, the program went to 90 days outpatient treatment, which was with groups down at the VA, different groups on different focuses of addiction and alcoholism, and realized that it's a disease and it's treatable, and treat the disease, learn the coping skills, know when they're going to happen or what triggers you, and adjust your behavior accordingly. And that was a tremendous help for me. My partner says, she called me and she says, I think you're ready. So I went back to her place, and we've been together since then for the last probably 2 years, and we've been getting counseling together. The counseling progressed to a point to where she really didn't feel, and this was a VA counselor, she felt that we'd progressed to the point, and most of our issues were dependent upon or working on communication between the two of us, and that was sorely needed, and we adopted some techniques and things to help be kinder, gentler people when we interacted, if you know what I mean. To be where I am today, as far as my attitude towards alcohol, it's not even in my mind to speak, whereas before every day I couldn't wait till 5 or 6 o'clock to start to either have a drink of scotch or a drink of wine or something like that. There is help out there, and you can get by it.
Welcome back. We hope you liked that video, and we'd like to wrap up this conversation by having Dr. Coten and Dr. Fernandez back. Welcome back, both of you.
Thank you. So we just heard from a couple of veterans who shared their experiences using opioids, and we know that opioids can be very effective and helpful at times, and then sometimes they can cause some problems. So what do you guys have to say about the withdrawal aspect of the medication?
Yeah, so I think that's a great question, because I came up with some of the stories that were shared. Mm-hmm. There is a distinction between dependence and addiction. So people that use opioids chronically most likely will get dependent on them, meaning that if they stop using it abruptly, they will have physical symptoms, well, physical and maybe mental symptoms of agitation, hyperarousal, maybe racing heart, sweating, diarrhea. That does not mean that they're addicted to it. And, maybe you can comment on addiction.
Yeah, I think the physical dependence is often part of what gets people into addiction, because to prevent the withdrawal, they use more and they get stuck on a pattern of that. But the addiction really is the maladaptive use. Mm-hmm. And I think a lot of people who have chronic pain problems get into that kind of overuse without realizing that's what they're doing. They're using it to treat emotional pain, they're using it to treat withdrawal, they're trying to get an outcome that just isn't possible. And we do see a lot of people who, when they taper off the opiates slowly so the withdrawal isn't too bad, or they get on medicines to treat the withdrawal, there's a lot of people that get off of it and they pretty much say, my pain is the same on it as it was off of it. Okay. Mm-hmm. And we've had a number of people who start with, the doctors won't give this stuff to me, who actually end up saying, oh, I have pain, but it really isn't any better. And that, I think, is an important piece.
Right, so I guess we should also probably talk about tolerance and something else. But so tolerance is, again, with the body constantly seeing a certain medication or a class of medication, with time, very often you will need larger and larger doses to produce the same effect.
Right.
Again, this is not addiction. This is a physiologic and could be psychologic aspect of chronic medication use.
Now let me ask though, does tolerance, is that kind of the root problem to an epidemic that's happening nationwide, in which some of the statistics are that somewhere in the neighborhood of like 30,000 people died in 2017 from specifically opioid use? Is tolerance what's leading to that? Are they over-medicating because of the lesser effect of the medicine? Or are they just misusing it and not following their doctor's directions?
I don't think anyone has a simple answer to that question.
It's concerning, though, that many people are dying every year.
I think the CDC estimates about 115 people a day are dying from opioid-related death. And how do you guys, what do you guys think about that?
A lot of people who really accelerate their use. I mean, we've had a number of vets who end up using heroin. You know, the buying things over the counter or off the street, using way more than is expected. One of the things you see a real problem is people get clean, and then when they use enough that they kill themselves without realizing that. I think that's a very common piece that comes up with that.
What are the red flags that you look for as providers? When do you think it's a problem?
I think, you know, people constantly asking for more, repeatedly.
More in a sense of a higher dosage?
Right,
or
I need more, I need
frequency?
an increase. They use more than is prescribed. They are repeatedly, well, this was stolen or that was, or, you know, my roommate took it, and at some point it's just, we cannot go past this. And the pharmacists are pretty strict at the VA, but most places. And now doctors are being required to check, what was it called? The
PDMP, Prescription Drug Monitoring Program.
Is that a system?
For the state. And so I'll get something where someone comes in and they say, well, I've been on vacation and I just don't have this. And then we check the California prescription drug, and it's like, well, wait a minute, you filled 80 of them here and 160 of them there, and you get a list of all the controlled substances, what doctor wrote them, and where they filled them.
And so if someone thinks that they have a problem and they want help, what can they do?
With addiction?
Yes.
I think that there are a lot of addiction treatment programs within the VA. I think they're much more available within the VA than they are to the general public. You know, I think working with someone, it does get to be difficult when people feel like their doctors overreact. Oh, you had amphetamine in your urine, you're abusing drugs, I'm going to stop you completely on your opiate. We see that a lot. And, you know, it's hard. I mean, we could see who this guy was hanging out with. He thought he's smoking pot. I don't know who gave him what. That extreme, well, once and you're out, is probably real troublesome. But then we get in trouble, in a sense, for prescribing people that we know are addicts.
And what could someone do to prevent overdose?
Well, first of all, I think everybody who takes opiates
Should get Narcan.
needs to have Narcan. And I've actually had a number of guys who, when they're given that for their routine surgery, they said, okay, we're going to give you this. And anybody who gets a prescription for opiates needs the Narcan.
What is it?
And it basically wakes you up from the opiate overdose and reverses it.
It counters the effects of the
It counters
drug?
the effects. So if you've overdosed with a long-acting opiate, it'll counter enough maybe to wake you up, but then you're going to go back in if you don't get medical help.
And is this something family members or friends could administer?
It's available without
Absolutely.
a prescription. You can get it at any drugstore. There's a real push to make it available, you know, on all EMTs so that people just get given it, and you can stop a death. After that, one of the problems that comes up is people get treated with that, and then they overdose 3 days later, and there's no one there to save them. That's a message. If you need that, you better go get treatment.
I want to squeeze in a couple Facebook comments because we don't have very much longer.
Sorry.
We have Noelle from Facebook, and she says that veterans who are on medication for pain should be in front of a pain management doctor who also understands addiction issues. And Christoph from Facebook says, it's not so much the problem of taking opioids, it's the problem that those who need them for pain management can't get them. So what are your reactions to these comments? That if you take them, you really need a good doctor, someone like you, Dr. Fernandez, and that sometimes when you need them or want them, the doctors are reluctant to give them to you.
You asked me really easy questions.
Well, actually, Christoph and Noelle did.
Well, here's what I can say if you come and see me. I will listen to the story of your pain. I will take into account all of the factors that might impact safe or unsafe prescribing. When we prescribe opioids, we do it in a very, very controlled manner, meaning the patient and I will sign a written agreement before a medication is dispensed. And this just makes sure that the patient knows what the risks of these medications are, that they know that there's very specific ways that this will be prescribed. Single provider, no early refills, no driving under the influence. We will routinely check drug screens. We will also routinely monitor outside prescriptions. We will routinely give Narcan. We don't want to dismiss the fact that someone is having pain, but given what is happening in the US right now, we also don't want to dismiss the fact that 115 people are dying every day from accidental overdoses.
Right. Well, these are the accidentals. There's the intentionals too.
And so it's all about finding balance. So in response to those comments, I would encourage people to sit down with their prescriber and have conversations. They take time. Building trust takes time.
Well, I appreciate that you both are experts on this topic, and I think the VA is very lucky to have both of you as doctors. As veterans, we're lucky to have you because I think pain is a very real thing that the military experiences because of the conditions that our service members go through. And our veterans come home with this acute and chronic pain. And so thank you for being guests on the show, and thank you for taking good care of our veterans. We'd like to take a moment to recognize the service of Marine veteran Master Sergeant Leonard Baxa, who is also on our set tonight. Leonard served 20 years as a Marine in the aviation ordnance field. He also served as a Marine security guard and deployed in support of Operation Iraqi Freedom in 2006. We honor your military service and achievements tonight, Leonard. Thank you for allowing us to display your shadow box on our set. Semper Fi.
We hope you've enjoyed our show tonight. Before we go, we want to direct you to a few events and resources. Please check out our YouTube channel for previous episodes by searching for Veterans Voices of Contra Costa County.
To learn more about the VA Opioid Safety Initiative, please visit va.gov/pain management. If you're struggling with addiction or suicide and need immediate support, please call the Veterans Crisis Line at 800-273-8255. You can also visit veteranscrisisline.net. In September, we'll be talking about equine therapy in the veteran community. We'll speak with veterans who have benefited from it and those who support programs in our area. We hope you'll join us. To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. Our next live broadcast will be Monday, September 17th at 7 p.m. Be sure to tune in. This is Veterans Voices of Contra Costa signing off, wishing you all a relaxing evening. And for the veterans out there watching tonight, hua and ura.